Thank you for joining us for a summary of our report on access to adult tertiary mental health and substance use services. Mental health and substance use problems affect people from all walks of life. They may face stigma and discrimination, and they can face obstacles in education, employment, and housing. The costs to individuals and government are high when people with mental health and substance use problems don't get the services they need. Adult tertiary care is the highest level of care available in the province for people who need specialized mental health and/or substance use services. These patients are highly vulnerable and have substantial and complex needs. They may be homeless or at risk of homelessness. They may be frequent users of emergency services. They may have a long history of hospitalization, and they may even be involved in the criminal justice system. At one time, Riverview Hospital was the central provider of these services. Starting in the 1990s, however, these services were slowly transferred out to the health authorities as part of the philosophy of providing care closer to home. Riverview Hospital was ultimately closed in 2012. But this audit is not about the closure of Riverview. It is about the system as it exists today. We carried out this audit to determine whether the Ministry of Health and the province's 6 health authorities adequately managed access to these services. We found pockets of good practice, but the health system as a whole needs to do more to ensure that people with serious mental health and/or substance use problems and illnesses can access the services they need. Work is underway to establish provincial standards and definitions. We recommended the Ministry collaborate with the health authorities to complete this work and clarify roles and responsibilities. The Ministry and health authorities need more information to know if services are meeting patients' needs and to allow the system to better allocate its scarce resources. This means understanding where the bottlenecks are, assessing current and future needs of patients, and evaluating whether the programs are effective. We note in the report a number of good practices that can be shared among the health authorities. Each health authority faces unique challenges in ensuring services meet patient needs. All health authorities are taking action to improve patient flow through their facilities. No provincial data exists that identifies service gaps. However, we found that some people may not be well served by the current system. This includes patients with serious mental health and/or substance use issues, as well as acquired brain injuries, developmental disabilities, and/or a history of extreme violence or current aggressive behavior. These gaps in service are compounded by the lack of available resources for patients who are ready for discharge, such as appropriate housing, and pressures on other parts of the medical system, such as full inpatient psych units in hospitals. Accountability for addressing all of these gaps and barriers does not rest solely with the health system. Coordination with other partners such as Community Living British Columbia and BC Housing is needed. Some health authorities flow patients through their facilities as quickly as possible, while others do not because they know there are no step-down services available in their region. We are not recommending a one-size-fits-all approach, but there should be some consistency to ensure fair and equitable access to these services. We are encouraged that the Ministry of Health has fully supported all of our recommendations and is already working with the health authorities in this area. Leadership from the Ministry is important for ensuring that the momentum keeps going. Overall, we recommend that the Ministry and health authorities work together to clarify roles and responsibilities, improve informed planning around supply and demand of services, monitor and evaluate access to the services, evaluate whether these services are achieving sustained positive outcomes, address gaps in services, and fully identify and remove barriers to access and discharge. We hope that all stakeholders in the mental health and substance use system will consider our findings and recommendations. Thank you for joining us today. To read this report and others, or for more information about our office, please visit our website at www.bcauditor.com.